This is how black people get killed. When you send them home and they don't know how to fight for themselves. I had to talk to somebody, maybe the media, somebody, to let people know how I'm being treated up in this place.
Chilling words from a well-respected doctor in the US who took to social media to vent her frustration at not being taken seriously by white doctors at Indiana University Hospital. However, just 1 month after this video was posted on social media, Dr. Susan Moore was discharged against her will and sadly succumbed to the coronavirus, leaving behind a son and many grieved friends and colleagues. Her concern was made all the more clear when she stated that she no longer trusted the medical team responsible for her care, stating that the bedside manner displayed was not how patients should be treated. Dr. Moore, herself a trained and practicing medical doctor, complained of several examples as to why she was not being treated correctly, including being refused antiviral drugs, being made to wait long periods, and having to beg for a CT scan on her chest, proving that her symptoms were real. The doctor on the case stated that he was uncomfortable in prescribing drugs to her, making Dr. Moore feel like an addict, sparking Dr. Moore to react by saying that this is how black people are being killed in the American care system. It seems that this is not a one-off case in the US, so why then does it take a high-profile case such as Dr. Susan Moore to raise awareness of just how black people are being treated so unfairly in the United States of America?
The case of the black physician who recently passed away and experienced discrimination in the US hospital after experiencing COVID-19 is a perfect example of the systemic racism that is embedded into the US healthcare system. The US healthcare system was built on the back of exploitation of black and brown people, and in fact a lot of vaccines and a lot of medicines were first tested on enslaved black people in the US South in the United States prior to being released to the general public.
Very sadly for a nation that prides itself on the land of the free and the land of opportunity, it seems that some people are more free than others, as the US has become very Orwellian in its perception of racial freedom. The Black Lives Matter movement proved that a range of institutions is deliberately targeting the black community, imposing inequality around every corner for those who come from black and non-white backgrounds. Yet when it comes to COVID-19, Dr. Moore's story is all too common on the wards and in the emergency rooms of the US, with the coronavirus disproportionately affecting black people in the country. In fact, black patients are being hospitalized at 4 times the rate of white patients across certain medical institutions, and within the poorer areas of the US, figures show that over 70% of COVID-19 cases are within black communities, suggesting very little is being done by the authorities to stop the spread in these areas. The clear reason behind this is the institutional racism that's rooted deep within the heart of the US, raising the question as to whether this is something that's always existed, increased under the presidency of Donald Trump, and whether a new president can start a new chapter in racial equality when Joe Biden enters the White House.
In order for the situation of healthcare for Black, Latino, Indigenous people in the United States to improve, there needs to be a total restructuring of not only the US healthcare system, but the US economic system. In the United States, you are not a patient at a hospital, you are a customer. If you don't have insurance, you're out of luck and you're not going to receive the help that you need. And we've seen this countless times over and over, especially with COVID, where we have high death rates among the Black community, the Latino community, the Indigenous community. Joe Biden, the president-elect of the United States, will definitely not improve the healthcare situation because he's backed by some of the biggest pharmaceutical companies that have created this very system.